Good afternoon, everyone. This is Martin Gershon, and I am here with an incredible entrepreneur, Emilio Goldenhersch, on another BetterHealth webinar presentation. It's really a pleasure to be here today because Emilio is a psychologist by training, and he has a very passionate personal story to tell you about his entrepreneurial journey and about this groundbreaking VR technology in healthcare, which is addressing many unmet needs in the mental health space. So first, I just want to take a pause and thank everyone for tuning in. It has been an incredible journey so far with an amazing response from viewers and attendees who have watched the recordings. I want to urge everyone to please subscribe to our newsletter, which is simply subscribe at gershoncapital.com. And I want to again reiterate a bit of the format that we're using for the BetterHealth webinar series, which is to first and foremost highlight amazing entrepreneurs who are mission-driven and who are dedicated to improving the healthcare system using innovation and technology. We've segmented the month in weekly episodes where 1 week we will have a unicorn, one an emerging company, one a company that's focused in on diversity, equity, and inclusion, and one which will be a grab bag of both macro issues as well as opportunistic possibilities for that particular week. So I would like to turn this over to Emilio, and he can introduce himself and give us a sense of his background, some of the things that he has experienced on his journey, some of the amazing people, and most importantly, what he sees in his vision for the company impacting patients. So Emilio, if you could tell us a bit about yourself and your journey, that would be a great start. Thank you so much for joining us today.
Please, thank you, Martin, for the invitation. I'm very honored and glad to be here with you today. And also, hey to everyone out there watching and attending, and also that are going to be watching the recordings later on. As you can hear, my accent is from Argentina, so I'll start from there. I was born in Argentina, and then my background, as Martin was mentioning, I'm a certified psychologist in Argentina, did the master's on mind-body medicine, also a psychology master's. And then for the past 7 years, I also became a researcher in the field of virtual reality, mindfulness, exposure therapy, and other psychological frameworks that I'm going to share with you a little bit more in a bit. But again, I'm very glad to be here. One of the things that I always like to also share is a bit of my journey and how I got to this point in life. When I was young, very young, and I finished my high school career and everything, I decided to move from my country, from Argentina. I moved to Israel, where I spent several years studying a different career, movies and cinema. But then in one of these back and forth moments of my life, I lost my father due to mental health and to addiction. And that was my turning point in life. It was a very sad situation. I think that everybody that has experienced some loss, can share that as well. But the point is that made me stronger, and I realized that I wanted to become of service to the community, to the people, and really that was the point where I decided to become a psychologist. It took several years to study, to dive into it. I started traveling to India, where I lived almost a year and a half, also working on meditation and getting into different Eastern culture practices. And then this bridge between the ancient Eastern practices and then the modern science from the Western, as it says, this bridge is something that really took my attention, and I started getting into it more and more. And at one time I came to the realization of this science called cognitive ecology, which is based on a specific branch of epistemology of this ecological thinking. How can we resemble ecological thinking into our daily lives, but from a psychological perspective? So I started studying a lot about that, and then also bringing into the practice with organizations, also with clinical practice. But most importantly, when I got together with two co-founders, two friends from high school, that we are all the three of us from Argentina, from Cordoba, and around 7 years ago we got together. It was actually my brother's wedding, where we got together, and we decided to start a company, the MindCo Health, by also bringing everyone's knowledge into play and creating this scalable and cost-effective self-empowerment tool for people to help themselves with mental health and behavioral challenges as is of today. But that's a bit of the story. I always like to say that it's thanks to my co-founders that we can actually create this. They have a specific knowledge and also a great passion about it. So we merge biomedical engineering with medical devices knowledge. Also, we merge marketing with virtual reality, kind of social impact, but then the psychological framework and how to create a tool that first is tangible, you can actually touch it, and it's not just an app living in the virtual world, but also it creates a way for us to learn how to relate to our environments. By definition, mindfulness includes this: how do we relate to whatever we are having? So virtual reality is one of those technologies that enables people to recreate a world, to really have control over the environment, and that way we are able to train our relation to the environment. And that's something completely unique, that it's a full perception shift between a two-dimensional technology into a three-dimensional technology. But I'm gonna just make
No,
it
that's
back and forth. Sorry,
fascinating.
sorry.
No, it's fascinating because I am a neuroscientist by training, and my focus has not been on the psychology side. It's been really more on the neuroanatomy, neurophysiology side. But we all know that there's an incredible mind-body connection, and we all know that unfortunately, healthcare providers are really not trained to understand the power of that. There have been many books which have looked at the connection between the mind and the gut, for example.
Mm-hmm.
There is a well-known book actually called The Second Brain, and so the pathways, have been mapped out, between the central nervous system, and various organs, but we haven't quite figured out, that, let's say, subjective quality of emotion or feelings, and how that is manipulated, by the mind. What the neurochemicals are, we have a general understanding of, quite a number of them, but the ripple effects we're not really clear on. We understand how they impact organs, as you know, but we don't understand things from a holistic perspective. So when you bring
Mm-hmm.
in aspects of Eastern medicine, which is holistic by its very nature, that really, pricks up my ears, and I want to know more. So
Well,
that's a perfect segue into explaining more.
I love that, because these past weeks I came across this very nice book by Daniel Goleman talking about emotional intelligence for leaderships, this primal leadership. That's the name of the book. But also getting into neuroscience a little bit, and how the emotions are created, or how even Eastern civilizations, and like even the Buddha was talking about how the molecules and the particles in the brain are materialized and then getting into the bloodstream, and then creating these kind of wavelengths of emotions, and how we end up resonating as a whole person with that emotion. So there are many theories out there that, when put together and when seen as from a perspective, we can see how these all ends up with how we are embedded into our ecological niche, right? Like we are not alone, we are not separate from the environment. And when we try from a very reductionist perspective to just look at the human body and the limits of the skin, we are not actually looking at it in the right way. We have to extend that kind of perspective and understand that we are where we are and we are not alone. So by actually bringing this knowledge that is been there for many years, and also putting up from this super specialized neuroanatomy and the way everything works within ourselves, we have to realize that we are where we are how we relate to the environment. And if we live in California or we live in Cairo in Egypt, we're going to be different people, because we're going to be relating to the environment in a different way, because culture is different. The way we are relating to affection is different in different cultures. And I think that once again, technology comes into play here, because how can we enable everyone to have the feeling of having the power by themselves to train themselves, how to actually create better habits, better behaviors. And once again, virtual reality is an amazing technology that allows us to create these environments, allows us to investigate, to research, and to understand what are the specific cues in the environment that trigger these internal emotional pathways that are going to ripple on my behavior later on. And maybe, there is some kind of blockage that the emotion cannot go through, and then I end up developing some trauma or developing some kind of illness. So by actually learning from the environment and within the environment, we are able to materialize different things that just by reading or just by the use of the imagination or visualization we cannot. So that's something that really is intriguing for me, and I really I'm really passionate about learning more, because at the end of the day is how we come back to the body.
No,
Most
that's
of Yeah.
no, that's terrific. I mean, I think it's well documented, and that environment plays a role, in depression. It plays a role in mood. If you're isolated in a setting, you're it's well known that you're more prone to suicidal ideation. There is, for example, in Switzerland, a high rate of suicide for those people who are living in isolated rural settings. There is certainly known environmental impact in terms of cold climates, warm climates, huge environmental impact if you're part of a community or not part of a community.
Mm-hmm.
And so being able to potentially use whatever tool you have as a catalyst to either amplify or diminish different aspects, it certainly would be an intriguing way of interlacing environment into the mind-body connection. So I would love to perhaps move this conversation to a little bit more technical talk about the wow factor of VR and how you got into that, and a little bit about the wow factor of your product, because I know that the amazing thing about technology is it can cut across many different sectors, and I know that your technology, at its core, is looking at depression. It's looking at other areas in mental illness, but it's also looking at behavior modification for smoking cessation, which is a huge problem and a huge public health impact potentially. So I will throw it back to you to lead the charge on the next part of the discussion.
Well, that's perfect. I'm going to pull up the slides that I prepared just to make some visuals, make it easier. But yes, the company that I co-founded is called MindCo Health, and we basically deliver and focus on a new care delivery methodology, which is virtual reality digital therapies at home. And I just want to say that because one of the things that we really focus on as entrepreneurs is accessibility. We really believe that we have already the technology there that is available, and we shouldn't be waiting until there is like a massive adoption for this new high tech that was coming before from the computer connected, and now is standalone Quest or the Pico or different high tech devices. But most people never tried VR before. That's the reality. And even providers, when you have a hospital settings with limited time for nurses or case managers to actually educate patients on a new technology, but at the end of the day, everybody has a smartphone, even in rural settings. So we really focus on delivering our clinically designed and validated programs with the smartphone. So we ship this virtual reality headset that you see in the picture that is very similar to a Quest. It's very nice quality and everything, but it's just to put your smartphone there. It can hold any phone from the size. It can actually help people with glasses. You don't have to take off your glasses. So it's very easy to use. And we focus our programs first basing everything on CBT, cognitive behavioral therapy, following CDC guidelines. And we have a playlist of videos, like normal videos, 2D videos, but also audios, questionnaires, valid instruments to actually measure at different points in times, different kind of variables. And we have two components that are key in our programs. The first one is virtual reality mindful exposure therapy. I'm going to explain that in a bit with the background info that I already kind of share about ecological cognitive ecology. You're going to have very much, it's going to be easy to understand. But the other component is the human component. When we are speaking about mental health or about anxiety, depression, loneliness, when we are speaking about addictions, we always have to have the human component, because at the end of the day, we are with others as well. So it's all the tech, it's amazing, but also the human component it's a must. We offer peer coaching with people that have gone through that, with all the training needed to actually provide the best support as possible. And today our company serves the underlying behaviors that, when done chronicle, they develop non-communicable diseases. Today we have smoking cessation as one of our programs that has been already, and I'm going to share with clinical trials, and he's been used today for thousands of people. The same goes for stress management as the first and second circle of prevention, either as an outpatient behavioral program, as a population management tool, or different kind of interventions as well. Now, how this really works as from the neuroscientific place, but also why with virtual reality. One of the things that I always like to really say is that the change as really changing one's behavior doesn't happen at the cognitive level only. It's something that really happens, and it's embedded in our bodies. So how do we address the bodily sensations? How do we address those feelings and things that appear in our body, and then we act upon them? And what we did is to merge several clinically proven frameworks, as you can see here: exposure therapy, CBT, mindfulness, also human support, into one component, what we call virtual reality mindful exposure therapy. We merge people in situations, we elicit different kind of cues into by controlling the environment in virtual reality, and then we tell the person, we guide the person how to recognize those feelings or those sensations. So imagine a smoker that is having COPD, and also the doctor mentioned or highly suggested that they should quit smoking. And it's been very hard. They tried several times, it wasn't able to do it, but then they quit. And then 3 weeks later, they go with their friends, they have a beer, they have a drink, and everybody starts smoking, and that's going to trigger the person. So even if the person quit and it's very hard even to keep abstinence, they cannot close their eyes and really visualize what's going to happen when they go out again with their friends. So exposure therapy is just, we expose the person to that kind of situation. And while happening, we deliver a mindfulness narrative, so they get identification into that kind of senses. And that is able to actually move the readiness to change scale, the motivation scales, but also to provide a better sense of presence. And that's something that we didn't only just analyzed and studied the over 25 years of clinical trials with meta-analysis and on the how the virtual reality component works for behavior change. But we also run our own clinical trials as an emerging company, early stage, as you all know, as Martin was mentioning, we are today on that kind of vertical. We really focus on research. We really want to be the first program out there that has enough clinical evidence to say that over all the alternatives in the world to quit smoking, we are that one with virtual reality. But also for stress management or for nutrition or for loneliness, how do we get to really empower people by themselves, to give that self-empowerment tool? And that's something that we have been really focusing on creating the science behind it, not just the clinical trials as well. We publish papers already with tier one universities and clinical teams from Stanford, mainly from UC Denver. We're working with different audiences, and we achieve 3 better outcomes than standard of care interventions. And that's for a problem that is unsolved, let's say smoking cessation. Having a new alternative that has been proven to be 3 better times than the traditional methodologies is something very good. Now, one of the things that we have been doing over is to not just work on the research, of course, and the clinical trials, because we did that already and we continue to do it, but also to move into real patients, real life data, real people having the real problem, and not waiting for the massive adoption for the high-end tech to get down to their hands, but actually going out and providing this tool by different channels that may be non-clinical channels. Because as we all know, healthcare has its own limitations, and it's not the best way to provide access to health for everyone. So what we have been doing is by going through corporate wellness as a benefit for their employees, like of a first responder, let's say, through their medical team or their benefit team. We have also going through insurance companies as actually having a member being in a different setting that is probably unemployed or have unemployment, but they don't go to the doctor to look for different anxiety or depression symptoms, so we can get to them. Also, as an outpatient behavioral intervention for people suffering from alcohol addiction, when they get out of the inpatient treatment, they go with a virtual reality headset home to work on the comorbidity, like smoking, for example, or to keep their stress at different levels. And by working with hospitals, we also create new revenue streams for them by either bringing on new patients. Imagine you have one of the biggest problems in different kind of workflows that we have in the health systems today is those patients that have high risk of developing lung cancer. So we have many hospitals across the country having low dose lung cancer screenings, but there isn't a real option for smoking cessation to those workflows. So we are becoming one there. And one of the things that we have proven also is the level of adoption. Usually traditional methodologies, they have 1%, 2%, 3% of adoption. We have 25x higher adoption than those methodologies. Almost 55% of eligible members for the specific behaviors we work with actually raise their hands and enroll in our programs. And that's something that is really beneficial for all, not just for the end user, the patient, the employee, the member, but also for the system, because we're able to prevent new or more problematic diseases to continue developing.
Can you talk a little bit, Emilio, about the user experience? Because I believe embedded in this therapy is a sustained use modality, so that there are, I think, important needs in terms of the user experience, kind of reinforcing the behavioral changes. And then second, that there can be multiple use cases. So, wanting to go back and use the VR equipment is an important component.
Correct. So and I like that fact. So the way this works is quite simple in a way, because we want to make it accessible, cost effective, and very scalable. And for that to happen, any person, any patient, any employee, anybody that is going to be the end user, just downloads an app from either the App Store or the for Android or iOS. Even in Spanish, we have everything as well. Even now we're translating into Portuguese, and also having the overall integral approach in the same language. But the point is that you download an app, and when you enroll, 3 to 5 days later, wherever you live, you're gonna get mail with the box, with a virtual reality headset, very nice, with a booklet, with some stickers to actually place as environmental cues in your own kind of setting. So you are reminded with these visual triggers, as visual cues as well, that you are in a program, you are in that behavior change modality. And then the person just gets a call from our peer coach team. Either also can be like a one-on-one video call as well, where we just set the objectives and make it clear how to use the VR, because 95% of the users that we have never used virtual reality in their lives. Not just for entertainment, that many people try the roller coaster or some kind of military thing, but this is completely another level of things. This is mental health. So we get a call where we explain, you just place your phone in the headset as it goes there. The app also explains that it's very easy to use, but at the point that we need to have that bonding with the human component, so we create a longer kind of empathy, right? And it's not just the technological piece, the one that creates and increases the engagement over time. So answering to your question, somebody enters, and we have in the same modality, in the same modules, for either smoking, for either stress, 2 stages. The first one is training, intensive training to change or get ready to change. And the second one is maintenance and strengthening of emotional and practical coping skills. And it's basically like a CBT, 8 weeks, 16 weeks program, depending on the mode, for a playlist with 2D videos, as I was saying, formal mindfulness. But they'll say you have informal mindfulness, and also you have psychoeducation in the virtual reality space. So there are different modalities to keep the patient or the user entertained in between sessions, in between logins into the app. You also have journals, so people can check in every single day. You have even a virtual coach, like a bot there. We also have a bot component, but we also have the human component, because again, everybody's different and everybody needs different things. So the user experience is kind of the same for everybody, but the things that are happening in the app with the personal component is also different, because everybody needs different things.
No, that's terrific. I want to take a second to thank our audience. We have people signing in from all over the world. Nikhil has signed in from Canada. Andreas, thank you for joining. Mark, thank you for joining. Jenny, thank you. Please let us know where you are and some of your thoughts and comments. We will respond to all of your comments, whether here live or we'll get back to you during the week. So please let us know, where you're from and what your feeling is about this very, very important healthcare issue. So now, going back to the technology aspect of it, what is the, let's say, ability to shape these different environments? You talked in the early part of the conversation about, being connected to your environment. It's kind of an ecosystem that you're building out where the person and the environment are at one with each other. Again, kind of, this Eastern-Western kind of combination. Can you amplify on that a little bit about, what can the user expect and how modifiable is that experience?
Yes, of course. So at this stage, what we have, there are 2 or 3 things to mention and to frame this question. One thing is that by actually us working with mobile virtual reality, the level of interactivity that you have with the 2 controls, with the high-end tech, you don't have it. So by actually having this accessible and scalable for everyone, we have this kind of trade-off, right? We don't have access to the amazing tech that you can have and play around with your hands and pull things up. So you don't have that kind of interactivity piece. But we do have is the narrative, descriptive situation where you are like in a movie, you are you, or you are looking at something else happening. So those kind of interactions happen more into a dynamic thing, right? Like we place yourself into a situation that is very familiar. Like let's say it's a smoker, and let's have two examples I'm going to give for smoking and one example for stress. For anybody that actually ever went or is involved in a smoking cessation group at the hospitals, the very first session, like in an Alcoholics Anonymous meeting, it's called like for smoking cessation. The very first session, it's awareness on smoking your cigarette. So you do like a practice where you practice what happens at every single step since you have the craving arising. Then you lit the cigarette, you take the cigarette, you lit it, you do a couple of puffs, you feel the air. All that exercise that happens in a group, we actually have it as the first activity in the program. So become aware of the overall process. Is like you sit in a space where we added also color therapy and other stimulants using the VR environment, but you're looking at all these cues that are going to be triggering you 100% to want to smoke. We are eliciting craving, and that's something that's been studied for years. And then on later stages, you smoke the whole cigarette and you get to understand. So most of our users, when they continue after that session and they smoke a cigarette, they say, "Oh, I'm smoking a cigarette. I realize that now." They get out of the autopilot. So this kind of 48% of the day we are daydreaming. That's the studies have shown, right? So daydreaming is moving a lot in autopilot. So how do we move a little bit the needle into the awareness zone? And that's what's the impact of this virtual reality mindful exposure therapy has. Get you back to the present moment. But not just in the training, also later on. Another example is when you go and have a coffee, reading the news, with a cigarette. That's like a very normal thing to do. So we place you in a coffee place, everybody is reading their newspaper, drinking their coffee, and smoking. And somebody comes to ask you for a smoke. And then you end up smoking the whole cigarette with that person. So again, those kind of situations that are familiar, we place the users in those situations to live and relive until they are able to re-signify those.
No, it's very powerful. I can tell you from personal experience, I have done a number of different sports at a very high level, and part of training, I teach skiing, for example. Part of the training in any type of race environment is visual imagery.
Mm-hmm.
And so, before every race, every racer walks the course and embeds that image in their mind, and they know exactly what their body is going to be doing, where the turns are, how they're going to initiate pressure on their skis. The visual imagery component of sports, I think, is
This is
extraordinarily powerful.
This is a great example. Studies have shown and compare visual imagery, 2D video, and virtual reality. And if you know, now I guide the meditation. So imagine yourself in a waterfall, etc., etc. The other one, I just share my screen with a 2D video, and you see the waterfall there with the voice. But then imagine yourself in the waterfall, because what VR does is tricks the brain as if you would be there. The same with dreams, the same with mirroring neurons, the same effect. The same effect at the brain level is the big component of VR. It can trick the brain to make you think you're there.
Can you talk a little bit, just to get a little more granular, since we're both scientists, a little bit more granular on what you're measuring in any of these clinical studies, because that's really fascinating. I just want to take 1 second and thank everyone for putting comments in the comment section. Thank you, Katie from Virginia. I appreciate you dialing in. Thank you, Kelly from New York City, down in Wall Street to be specific. Thank you, Andrew, also from New York. Ariel, from don't say, but Andreas from Boston. So thank you all. Ariel's from San Francisco. Excuse me, Ariel. So thank you very much for chiming in. We appreciate you as viewers, and your comments and thoughts, of course, are greatly appreciated. So getting back to our discussion.
Yes, you were about to ask something that more granular.
Yeah. So in terms of the clinical trials, because as you probably remember, I ran a clinical trial organization, which was one of the largest in the Northeast for many years. And I do have a background in clinical trial design as a Food and Drug Administration attorney. So, it's very important to understand that 90% of early stage companies, they don't design clinical trials properly. But, the work that you're doing indicates very strongly that you really have a grasp on what the primary endpoints are. So with that.
Yes. So I agree with that. And there is a big story about that. Also, I can share some entertaining story about our first
I see
trial.
a follow-up webinar in our future.
The point is that we do have two different kind of measurements, right? Like one things that we do that are in clinical settings are where we can measure with biomarkers such as respiration, we can measure heart rate variability, we can measure even different kind of things connected to the body when the person is experiencing the VR component. So with the University of Denver, for example, we are under a clinical trial measuring these kind of things, or how much cravings does our content elicit, comparing A, B, and C. And that is one of the things that has been done so many times in the past by 25 years of other researchers, which we shouldn't be or couldn't choose not to do it, because that's have been proven, not with our own content, but yes, with similar content out there. What we have done very specifically is how to decentralize clinical trials in terms of places. We have run clinical trials in Argentina, in different places in the States, in different states with different populations, measuring most times through the app self-subjective questionnaires that are clinically validated instruments and barometers in different countries. So that's what we usually do. And then for those that are also able to work with the lab and have a specific verification pre-post at the lab. For example, with one university, we are doing hair cortisol measurements pre-post for college students to measure their level of stress by pre-post the intervention for stress management and associating different kind of concepts. But usually the design is a frame on the virtual reality framework for clinical studies that has been done by the major academics in the West Coast, in the East Coast as well. And there is a whole framework to how to run VR clinical trials. And then also we have to push the boundary a little bit, because when we ran our first clinical trials back in 2018, it was the first worldwide VR smoking cessation at home trial study in the world. So we didn't have really like background information, how to do it or how to frame it. So even there we did it. But we do measure self-subjective,
yeah. One of the things that is important to me, as a physician, is to improve the healthcare system. And one of the things that's important to me as an investor, since we do run Endeavor funds, is to find large themes that will be sustainable investment themes. And one of the incredible themes that you've underlined several times is the at-home care piece. So in prior webinars, we've talked about the incredible amounts of money that big tech has put into healthcare and continues to pump into healthcare. And one of them, of course, is Apple, who is clearly going to dominate the at-home care space. This movement, it's very much aligned along two verticals. First, it empowers the patient. It allows the patient to have diagnostics at home. It has therapeutic potential as yours at home. And then second, it provides an incredible economic benefit for the overall healthcare system because most of the cost is found in hospital settings. And moving it from hospital to at-home settings is a huge driver. So I'm just thinking, that it's a perfect fit, really, for this thematic rollout over the next decade or more. And I would imagine that there's going to be multiple diagnoses, multiple ways to add devices, since wearable sensors are now coming of age, to be able to incorporate your VR into that. Have you thought about where the company is going? That's an important part of any startup, having the vision to see 5 years out. Have you thought about where you think you want the company to be, who you want the company to partner with and collaborate with?
Yes, absolutely. And I agree that we're moving from that times of at hospital to at home settings to actually work and move a lot from the assistance part to the prevention and promotion part, right? And I think that's one of the biggest shifts. And that's where behavior is going to start having a bigger and more relevant role, because up until now we weren't caring about behaviors because, oh yeah, people get into the hospital, it's already happened, right? And even the clinician would be recommending having a better kind of lifestyle or a better habits, but it wouldn't be actually really happening. So now, by being able to be at home measuring many things, we will be able to provide better kind of tips or frameworks or lifestyle kind of modalities. So behavioral health and mental health are going to be key for this transition to at home, right? Just for saying that. And where the company is going, I think it's going to move into two different, it's going to integrate two technologies, but most important, is going to move into and remain at home. And we are planning to stay as accessible as possible, as longer as possible, because again, we have our things, we can move everything into the Oculus, the metaverse, but that's still not accessible. And one of the things that we plan to do in the future is to partner with big payers, with big insurance companies, with big providers, to incorporate this technology as part of one more tool of their at-home settings. I got there the only on the screen. I got scared.
Technical goal.
But yeah, but the thing is that really we're looking to partner with payers and insurance companies and hospital systems to actually incorporate this technology from an outpatient, from an at-home situation, and in an affordable way. We don't need new education for new technology yet. Yes, for more acute kind of interventions, but for really providing behavioral training, behavioral modification, and mental health assistance when there is still time to really prevent and help on the promotion. That's the gap where we can get in. And by incorporating AI, by actually funnel of AI conversations and the like up until we get the human component for a little bit more acute interventions, is where we're heading right now. And in the future, again, I will say we'll go back to the body. So bringing on haptic technology where we can actually feel the body, it's where I envision our technology as a company to be heading in the next 5 to 7 years.
Well, first of all, I think we're just scratching the surface here. And I'm completely serious when I think we should look to the calendar to get you back as quickly as possible, because what I see here is a very, very fast moving story. So, it's exciting to be able to talk with you about some of the incredible advances that technology has brought to patients. But I can see that you're looking at partnerships, you're looking at ways to amplify the effect, you're looking at ways to validate through partnerships with multiple universities and do clinical trials. So there's a tremendous opportunity, and this is really a shout out to people watching, to reach out to Emilio, to reach out to myself, because this is a story that speaks to what I consider one of the most important and exciting things of our time, which is new leadership in entrepreneurship. And I think what we've heard here today, one of the important aspects, which we perhaps can pick up on our next conversation, is the notion that mission-driven companies, sponsored, supported, and driven by passionate entrepreneurs who build teams, who build collaboration partners, and who have a vision which is very much centered on improving the community and improving people's lives, is really a paradigm shift. And I think that, over the years, Silicon Valley has supported some CEOs who have had bad behavior as CEOs. There's just no other way to put it. And those times now, I think, are changing in part because of COVID. And so, in part, this tremendously horrible pandemic has impacted all of us, but it's also brought us together to recognize that mental health is a tremendously underserved problem, and that part of the core to this answer is developing communities. And
Mhm.
so I really have to applaud you, Emilio, for stepping up. It's never easy to be first to the plate. And your description of how your VR clinical study about smoking cessation really, has led a tremendous, new charge. I think we need to explore that further. So, love to hear
Uh,
your thoughts.
Yeah, first, thank you also everyone. I now reading the comments. I'm gonna answer and address them in a bit. But thank you also, Martin, for sharing all that. One of the things that I've been getting is that as a CEO of a mental health company, being a psychologist myself is kind of pushing the boundaries a little bit as well, because there are many clinicians turning like doctors turning entrepreneurs to address the problems from the healthcare system as a provider. But as a psychologist, I would love to see more happening, because right now this is the biggest mental health crisis in the history of humanity. So it's something that I really focus on creating this ecosystem. So I'm very much welcoming everyone who wants to actually offer something, partner, ask for something, even for help that I can bring. I'll be happy to. And addressing the questions, Andreas, you asked about the AI and VR integration. I think that we are heading that way, as I was mentioning before. And Michiel, you're asking about if the app would eventually lead to a VR individual session for patients. So right now, what we're doing is providing individual sessions for patients with a VR therapist as a recorded thing. So today we emulate that situation of therapy in part as the CBT program, and eventually will lead to suggestions and recommendations to pursue a further appointment with the clinician as well. So yes, the answer is yes. Today we're doing a bit, but we're going to extend it as we were mentioning, part of the ecosystem, as being incorporated as a tobacco tea program or stress management, nutrition management for any provider. We would be the in-between sessions, and then they go back to the clinician on that sense.
One thing that I want to end, this exciting webinar on is a bit of a somber note, but an important note. There is a horrific war going on in Ukraine, and I could foresee at some point in time a use case for post-traumatic stress disorder, because I personally am involved with Doctors Without Borders. There is a tremendous, tremendous community of caring, giving healthcare providers that need tools like this, where people can help themselves in a community, in an environment, that builds on support. And so that is something that I want to really emphasize, that the ability to impact people's lives with technology is really dependent upon leaders with vision like Emilio. So I really want to thank you, Emilio. It's been a pleasure talking with you. I can think of 20 things to share with you offline already, because it crosses over, so many different important areas of health and wellness. So I want to thank everybody for attending. Terrific comments, great energy, super important topic. Um, Thank you, everyone. Have a tremendous rest of the day. And thank you, Emilio, if you'll stay online for just a minute.
Yes, thank you, everyone. Thank you, Martin, for the invitation, and have a beautiful week. The rest of you, breathing in, breathing out. That's the way to go.
Bye bye, everybody.